Even though COVID isn't talked about every day like we did 2 or 3 years ago, it is still prevalent 4 years later, with President Biden himself fighting the virus right now, along with a lot of other Americans. THV11's Brooke Buckner joins us now with what we need to know about the current summer COVID wave that's here in Arkansas. Brooke?
Rolly, the latest data from the Centers for Disease Control shows Arkansas is one of 7 states ranked in the very high category for COVID wastewater viral activity. One local doctor tells me he's noticed it picking up again and says we shouldn't let our guard down.
Most of the activity that we're seeing is in our ambulatory clinics. So patients are coming into our urgent care clinics to their family doctor with thankfully, fairly mild symptoms.
President of CHI St. Vincent in Hot Springs, Dr. Douglas Ross, says most of the current COVID cases they're seeing are like a bad summer cold.
We do have, from time to time, a patient get admitted to the hospital, but typically it's a patient that has maybe a lot of underlying risk factors, maybe some underlying lung disease or cancer or something along those lines.
Since the beginning of May, the CDC says they've seen an upward trend of COVID in wastewater.
COVID tends to have kind of these peaks and valleys at atypical times. So I think the important news is that we still need to be prepared for those. We still need to be aware that COVID is out there. It's not gone.
Dr. Ross says that's especially important to remember as people continue to travel for the summer and with the new school year right around the corner.
I think just having some common sense and really even rewinding for what we've done with the flu and colds for years, COVID is spread very similarly. And I think having our radar up for that will be very helpful.
Although the demand for the booster shot has gone down, he still recommends it, especially for the elderly and those with underlying health conditions.
Those are the patient populations that if you do get COVID are going to lend themselves to more severe disease. And that booster is certainly going to take the edge off of that.
According to the Arkansas Department of Health's COVID dashboard, statewide we've had 52 COVID hospitalizations reported in the last 7 days.